Hi, everyone. Let me go through the questions, answers, and rationale for Exam 4 in our healthcare ethics class. First question, which of the following patients will benefit the most from EMTALA, the Emergency Medical Treatment and Labor Act? EMTALA, as a summary, allows individuals to come to the emergency department, receive a medical screening exam without primarily insurance or lack of insurance or payment information being asked on the front end. Um, and so really it's going to benefit everybody. But the game changer here is the gentleman who lost his job and his health insurance. That's the key thing. Um, and so that's who will benefit the most. Okay, question two. We talked about this in class. From an ethics perspective, why is the ED considered an area of coordinated chaos? Coordinated chaos, that's the key thing. What does that mean? Things are working, but they're happening for the most part in all kinds of different ways. Um, from people coming in to um, care being received, waiting time, people being admitted and getting a room, people admitted and having to wait, which is boarding. So, which one of these examples? The answer is A, multiple ways to enter the ED: ambulance, walk in, um, life flight, transfer from other hospitals. EMTALA. What does EMTALA mean? EMTALA is the key. It's the differentiator. It means everyone is welcome. It's an access issue. Remember, you are focusing on the ethics issue, which is access. Delay in discharging patients because of whatever reason. And then level one, which is the highest acuity. But the key, as I mentioned, is EMTALA. So focus on access. Which of the following, number three, best explains why the ED is considered safety net? What does a safety net do? Think about a circus. Everyone is caught, hopefully, um, but everyone can go there. And so, ED is mandated, that's EMTALA, to provide immediate medical care to individuals. Again, it doesn't have to be comprehensive care, regardless of insurance status or the severity of the condition. And it's required. Okay, so there's no choice. Um, all these other statements, actually, I'm sorry, D is a true statement, but it's really not the key to safety net. Um, and and it doesn't happen to every uninsured patient, but the key is the mandate. Let's go to number four, please. Consider the two emergency departments in Evansville. What's an ongoing ethical issue? What are the ethical issues that we talked about under access? Well, a variety of things, but where we focused the most on was boarding. Boarding, the idea of someone's been admitted to the emergency department, but they have to wait. And so what that does is it clogs up the system. That's the chaos part of the coordinated chaos. Okay. Number five, we're going back to the waiting room and the gentleman who was diagnosed with burns bone spurs. You don't have to remember everything, but he laid carpet. He was in a lot of pain. Um, he had to take a decrease in pay. But the question is, what's the primary ethical issue in this case? Especially because he's uninsured, he won't be able to see a specialist for his bone spurs treatment for 6 months. So let's go back to the ethical issue. What is the ethical issue? We talk about burden. He is physically burdened, emotionally burdened, financially burdened for sure. And there's going to be a delay in his treatment, and that's going to inevitably worsen his condition. You're always, always looking for the ethical issue here, and we think about the sort of burden on this gentleman. Number six, consider all the patients in the waiting room. What combination of themes best defines these patients. And so these are the ethics themes, right? And you see things, what matters most, and the relationship and access. Lack of autonomy. As soon as they come in, they don't have choices. They lose their choices. They have to wait. Sometimes they have to wait even though they're in pain because of the triage issue. And so they are naturally burdened. Also, every one of the patients that we saw, I mean, they didn't have insurance or they had lack of insurance. The insured patients, and there were insured patients here, we didn't focus on. Many of you chose access and affordability, and access certainly is the key theme. Affordability wasn't and is not an ethics theme that we discovered. I understand that, but it didn't really talk about necessarily the cost, the affordability. And affordability when it comes, sorry about that, affordability when it comes to the emergency department is a little bit strange because EMTALA says, even if you don't have insurance or you're underinsured, you can still receive screening care. That affordability would be more, here's the cost, can you afford it? If the answer is no, then that's an issue. But EMTALA sort of thwarts that in the emergency department. All right, number 7 is about the reading, quiz for reading. What's the primary ethical issue here? It is always about access. Happens to be about financial access coming from here. Number 8, who's likely to be boarded? Okay, so if you're going to be boarded, that means you have to be admitted. You can't be boarded just by being a patient in the waiting room or in the exam room. You have to be admitted. There's only one patient who's admitted. Um, and so that is the boarding issue. Um, if I do this draw. Okay. Number 9. This is Maria. Which of the following statements are true here? Um, and essentially, she received health insurance because it's primary care. I'm sorry, primary coverage. And so this is more, it's probably a less of an ethical issue. It's just a fact. It's got nothing to do with a private firm or whatever, but she reserves health insurance through her employer. All right, the last one is what best illustrates the systemic barrier to the workforce challenge? It's all of them. All of them. Um, Lack of clinical training spots, faculty shortages, high tuition costs. It is a big pot of chili. It's everything mixed together. So please look at your exam, review this, go through the questions and your responses too, and ask me if you have any questions, just let me know. Thanks very much. Bye.